Welcome to Talking Health Tech with Macadamian, where we explore the intersection of technology and healthcare. We've worked with many innovative companies to design and develop digital products that improve people's health, and we want to share all that we can to help people build better products. So let's get to today's episode. So today we have Lorraine, our Senior Director of Healthcare Services, and Dinesh, our COO at Macadamian. And today's topic is all about how product teams in medtech, pharma, digital health can make better product-related decisions and investments by doing some user research. And we'll get into what exactly user research is. But first, I just kind of want to talk about how this is a particularly interesting conversation to have right now, since things you knew about your product users pre-COVID are radically different today given the context of COVID-19. So Dinesh, I thought I would just start with this question for you. How have you noticed business models changing based on the conversations you're having with clients in the medtech, digital health, and pharma space? And what are some of the key shifts that teams are struggling with right now?
Well, I think we're all required to completely change how we work and how we engage with our health. I think one of the first things that I think people noticed when COVID struck was that they just weren't getting out nearly as much as they were before, and we got the creation of the walking meeting. I think we've all probably done one of those, and I think that's just it's characteristic of how we are adapting, and the stress on our system, both personal systems and our health systems and our economic systems, is really causing a lot of transformation. And the first and biggest part of the transformation is the move to digital. Um, and where once it was almost unheard of, unless you were in very remote parts of the world, to do telemedicine. That's normal now. If you want to see your doctor, you've got to call and make an appointment, and then they call you back, and it's a completely different experience. So I think there's the move to digital and move to remote is going to make is a fundamental change that is going to require whole new business models. COVID itself, from a short-term perspective, made a big impact on medtech companies, on hospitals, on primary care practices, and everyone was forced to reprioritize. And back in the summer, almost all elective surgeries were canceled, and that put a lot of pressure on anybody who provided technology or services to the medical industry. And we personally saw a big cutback in how people thought about the capital expenditures around new product introduction. So if you were working on a product, typical biotech or med device product, costs around $30 million to build. And if if you were down that path and you had no line of sight to customers in the next 12 months, a lot of people went, whoa, we need to pause right now. We need to really kind of get our own houses in order. And so we saw a major cutback on capital expenditure and innovation around medical devices, and of refocusing into things that were already in market and things that were cardiopulmonary in nature. So anything that would allow countries to respond to the effects of COVID, primarily the effects for anything related to your lungs, because that's where it primarily attacks. So that was one big change, is how people spend money was a massive change. Another was the fact that people who had historically been the healthcare industry is quite a rich industry, in the sense that there's a lot of money that goes into it. 50% of GDP goes into providing healthcare in most of the developed world. So it's a massive a spend for governments and for individuals. And so the result of that is many of the people who are involved in this industry, were used to having money to spend on stuff. And all of a sudden, doctors' offices are closing. 94% of doctors' offices were severely affected by COVID, in the fact that they weren't able to provide services. And so when when our customers are unable to purchase their products, you're going to really put a massive wrench in the system. And so these were just some of the observations we had through the course of the last 6 months. And companies like ours, which are all about creating better patient outcomes, we were forced to rethink for ourselves how we engage with health IT companies, with med device companies, so that we can address and react to this new reality. And that involved rethinking what that user experience in a big way, because it changed from being an in-person experience to a digital experience.
And I'm sure a lot of businesses too are brand new to this whole, um, I guess, digital world and having to move completely digital. It can be very intimidating, I'm sure, for people who are just not used to that type of business model. So, thank you for providing some context from a business perspective on just like some of the major changes that are happening in the healthcare tech market right now. And then, Lorraine, I guess a question for you. What do you think can help product teams right now when they're making decisions on about like what to focus on when it comes to product development and how to sell their products right now, especially for those companies that Dinesh mentioned who are entering an entirely new remote digital business world?
Mhm. Yeah, I mean, you definitely have to take if you weren't using research before, methodologies that were typically found in the research realm, then you definitely want to start using them now. And as Dinesh mentioned, we're tackling this at the moment with our clients. And so we've kind of identified for people three main things that they'll want to focus on. Right. First is identify those new market changes and opportunities. So this means understanding the ecosystem in which their product or service exists. And because even if you've had a long-standing product, that ecosystem has now changed, whether you like it or not, right? But you can identify the components of that remain the same. So what remains the same within that ecosystem? What has changed? And then map it out visually so you can see the impact of the changes on your product or service. So as Dinesh mentioned earlier, drug reps and medical device reps no longer have direct access to physicians or clinicians in the office or in the OR. Frankly, in many cases, neither do patients. Patients are calling in and not necessarily getting that immediate appointment. They're getting it virtually, but they're not. It's changed in that interaction has changed in a traditional way. So it might be a temporary change, or it might be an opportunity for businesses to address this challenge in anticipation that will continue as a new norm. And I think many people have identified that, especially when it comes to patient care, that there are new opportunities as a result of these changes. So, remote health monitoring, for instance. So once you identify what those changes means in terms of the ecosystem, then you can specifically zero in. So part two now is zero in on a problem or problems and explore the needs or requirements around that. So the telemedicine was one. How do we keep seeing patients without actually coming into physical contact with them? Telemedicine existed, but it just opened up new opportunities for them. But it's not just about telemedicine in that particular example, right? It's about remote health monitoring as well. So when previously you might have had patients coming in on a weekly basis or a monthly basis doing that check-in, looking at new ways to be able to do that from a virtual perspective. Again, a change because of COVID, but many people are seeing this as a long-term solution going forward, because it just helps you provide better care plans and better treatments for those specific patients and therefore patient outcomes. So really it's about zeroing in on that specific problem, exploring the needs. So you need to conduct design research so you can surface those insights on how you can then effectively mitigate risks or take advantage of the opportunity. And then last but not least, so step number 3, take what you've just uncovered in steps 1 and 2, and now apply a very critical look at your value proposition. You probably need to enhance it or change it in some way to reflect the new opportunities and changing requirements. And actually, this is where we see a lot of innovation occurring. So one example, for instance, one of the reactions that Macadamian had to COVID was implementing or creating a new application that helped with COVID screening for health networks. So for clinics, for hospitals, and of course it extends even beyond the healthcare space. And immediately we thought the value was on efficiency of screening because previously they were doing it on paper. So we're looking at efficiency and also safety, because before they were doing it on paper, so all of these nurses would come in for their shift, they're all congregating together, filling out their paper forms, and then handing it in to somebody who is then manually screening that. And so there was a safety aspect to it as well. Well, what we uncovered actually was that, yes, that's definitely a big part of the value proposition, but we were able to innovate in another way. And that was being able to provide this oversight and insights at the administration level, so they could realize efficiencies. So they had an idea of what that staff looked like at certain pictures in time and could plan accordingly so that they had the people on hand to treat patients.
So, in a nutshell, what people can be doing right now to leverage user research is to kind of take a holistic look at kind of what's going on their business environment right now, their environment that their product or their service exists in, and then dive a bit deeper, focus in on specific elements of that whole picture, specific challenges or problems, and then taking the information that you've gathered from step 1 and 2, kind of revisiting your value proposition and tweaking it based on the insights that you've gathered from those two things. Okay. And this is a curveball question that's not in here, but it just came up.
Okay.
um, and actually, I'd like to get both of your perspectives on this. A, because I just don't really know, um, and B, I guess being within the company, it makes so much sense to me. Like, it's very clear to me why user research would be something that's so valuable. But I wonder, like, why is this an area that is sometimes overlooked when it comes to making investments? Like, why is user research something that people don't like, they skip over? They don't think it's important.
Well, there could be a lot of reasons for that. Um, so, I mean, often we don't know what we don't know. And so that gets in the way of discovery, right?
Hmm.
And so to explain that a little bit, some companies feel like, well, we know our target user base, we know what they're doing with the product, but they haven't formalized. They just don't realize that they actually don't know, right? So many times we've gone into the field and come back to clients and say, actually, your users are not using your product or service in the way you thought they were. Here's how they're actually using it. Here's how they're adopting it. So sometimes it's really just they just really don't know what they don't know. Many people perceive user research as being really time consuming and expensive, and it doesn't have to be. I mean, it really depends on, are you looking at introducing a new product or service that nobody like is just going to be completely new? Then yes, you're probably going to want to spend a lot of time and money to make sure that you're going to get it right? That it's going to be something that's going to be adopted. It actually fits a need. There's a meaningful use component to it. But other times, I mean, so companies have their products in the field a long time, and they have been doing, getting little bits of information from sales reps, for instance, or from customer experience calls or customer support calls within the company, but they just don't know how to pull it together and then enhance that with qualitative research methodologies to really get the picture that they need in order to inform their product development cycles.
Yeah, and my perspective is often when you decide to do something, you're not doing it based on research, you're doing it based on gut. And uh, research is scary because you might have got it wrong. And if you got it wrong, what happened to all that money you spent and all the reputation you kind of staked on this thing? And so it's hard. It takes a lot of courage to go in and challenge assumptions, to go and ask questions that maybe you don't want to know the answer to, right? And this happens a lot in product development, right? Where you're building something and you've got this thesis and you've made a case based on this thesis, and then you get out into the market and it fails for whatever reason. Well, it's much easier to say we failed to execute than we built the wrong product, right? And so there's that component of courage that user research requires. It requires the ability to step back and truly be a researcher as opposed to maybe an entrepreneur, right? Or an intrapreneur, which means step back and let the data tell you what the data tells you, as opposed to molding a vision and presenting it to the marketplace. And so not everyone feels comfortable with that, and not everyone is able to do it at all stages because there's a cost associated with it. So I think one of the things that I've learned in a decade at Macadamian, and then prior to that, more than a decade building products, is that being able to answer the question how you know is really important. So if your answer to the question is how I know is because my experience, you're instantly in the wrong barrel or the wrong bucket, right? Because you should be able to say how I know is through data, not through opinion. And many, many, many times, companies rely on the opinions of experts, which doesn't mean that they're wrong. It just may mean that they're not entirely right. And getting to the ability to answer how I know, and how I know is I've actually done the research. I actually have the data. I have observed people in the context of use doing and achieving the outcomes that I'm hoping my product will achieve. That's a rock solid foundation to build a business on. And that's when we find the great companies that we work with are the ones that have the courage to go and ask those fundamental questions.
Hmm. Do you find that that has been like increasing over recent years where people are starting to build up that courage and have more of an interest to get like concrete data that validates kind of the opinions or assumptions that people make around their products or users?
It's
I
changing,
do.
right? I actually really believe it's changing, because it used to be that the world was fairly, not if not predictable, at least stable, right? And so especially in healthcare, things could change iteratively. Well, that's not true anymore. Just look at the last 6 months. Chaos abounds. And if you're not the kind of company that can sense quickly what's happening in the market, and then rely on what your eyes are telling you as opposed to what you believe, you're going to end up with a product that was good 3 months ago or 6 months ago, or heaven forbid, 5 years ago. And, like I said at the outset, it costs 30 million bucks on average to build a med device. You get that wrong, somebody's losing their job, and probably worse. So, I don't think it's where it might have been, debatably a luxury in the past because you could fix on the fly. I don't believe going to market in the kind of high complexity, high chaos environment we're in now without some form of research. And there's lots of, as Lorraine will talk to, there's lots of different scales of research and how you can do it, so you can be agile and you can, invest at a rate that's appropriate to, your budget and your business requirements. But to just say no, this is what I believe, and I'm going to listen to a couple of people and then go off and build with that, um, it can be considered. I mean, I know when entrepreneurs tell me that, I go, "That's irresponsible. You're gonna regret that decision later."
Yeah, and there's less tolerance for that in the market, in terms of your customer base, because if you don't get it right, you don't make it really simple for me to use, or you're not meeting a need that I need fulfilled, forget it, right? So even the consumer base, no matter what area you're in, has changed in terms of their expectations on what you as a company need to deliver.
Yeah, it seems like becoming user centric is definitely no longer a differentiator. It's like a requirement in order to survive amongst your competition. So, Lorraine, could you just provide a little bit of background info in case anybody doesn't have like a user experience or a human centered research design function internally on what user research actually is?
Yeah, well, so just building off of my last statement, so
Yeah.
I think many people know good design when they experience it, right? We have it in our hand every day. A product or service that makes the users their job easier or delights them in an unexpected way, or maybe it's because it doesn't get in their way at all, right? So it's just I barely notice it. That's still good user experience. What people don't realize is that great design experiences don't just happen. And so when we talk about UX design, that's where user research comes in. So the two are inextricably linked, right? So great design happens because it's informed by user research. So user research is about developing an understanding of users in relation to a system, a service, or a product, and the context in which they're using it. And so if you want to know whether there's a need, you want to know how to delight your users in some way, how, maybe it's about efficiency, or it just simply solves a problem for them. You can't just jump right into design and think, well, I'm going to put the best designers in the world on this, it's going to look fantastic. You don't get that. That's the tip of the iceberg. You need to do the user experience research in order to make that happen, because a lot of people do come to us and say, well, we just need to shine it up here or make it look better here. But you don't understand that, you don't have that foundational understanding, you don't fix the foundation, then it doesn't matter how pretty it looks. People are going to discover pretty quickly that it's not useful to them or they can't use it.
Sustainable competitive advantage. That's the key thing for me around research centered design, is that it is impossible to copy. You can copy screens, you can copy colors, you can copy icons. You cannot copy good fundamental research. It's not possible because you won't understand why they made the decisions they made for that design. And that turns into a sustainable competitive advantage for those product creators that are releasing products that use it.
That's a really good point. Um, and now there are probably many businesses that are hyper focused on what they need to do right now in order to continue to operate safely and responsibly, to keep sales up and to keep their customers happy. But there's a good chance that some of the COVID-19 driven market changes that are happening are going to stick, simply because the world is already moving towards like all things digital. So things like Lorraine mentioned, telemedicine and virtual doctor's visits, online health screening, you know, remote communication tools. So how exactly does user research play into making decisions that will benefit companies long term as opposed to just kind of keeping them afloat right now?
Who would you like to answer? Me?
Yeah, I'll start with you.
Okay. So, look, you know what? I'll let Lorraine speak to user research specifically, but I think knowing your user and knowing what their new reality post COVID will be is, that's just being competitive. That's reacting to your environment, and the big thing that I think will happen is that there's stuff that we really like about COVID, right? The environment loves the fact that we don't have millions of cars with one person in it going back and forth for 2 hours every day to work and home. that's really good for the environment. It's good for all of us as humans. There's other things like the remote work has really, in many ways, increased the productivity of folks because it allows them to focus on certain tasks. Many jobs have been automated through technology over the course of this COVID environment. So your context of use is fundamentally changed. If you're a producer of value in any market from January 2020 onwards, how people are going to use your stuff, everything from desks to chairs to computers to anything like meetings. If you're designing meetings, your meetings have to be different. Everything has to be different. So I think a lot of those things are going to stick because guess what? They were positive. They were things that we should have been doing. We've always had the technology to do. I think I have a bit of white in my beard, so I can say that I started looking at video conferencing as a way of collaborating in the mid 90s. So like the fact that it took COVID to turn it into something mainstream that everybody uses, that's 20 years overdue. And so these are things that I think genie's out of the bottle. They're staying. Travel is going to be quite different. Awareness of communicable disease is going to be very different, right? And so how do I work with a mask on? This is something I guarantee you no product manager ever thought about 12 months ago. If somebody is working with Outlook or some tool and they have to do it with a mask on, how does that work? How do my employees stay productive in socially distance or in an office where I need to have negative air pressure? All of these are things that you didn't need to think about because you worked in a certain environment. Guess what? It's all changed. And we don't know when it's changing back. So you don't have the luxury of saying, I'll just wait it out. Because if you do wait it out, you're out of business. So I think from that perspective, there are things that product managers have to look at and go, I need to be able to address this for now. So this is my product for now. And then there's a product forever. And you have to recognize and start making some bets on what are the things that are likely going to stay true even after we get a vaccine, even after things get back to a new abnormal.
Yeah. And I mean, to sort of bring all that back around, Dinesh mentioned a couple of things, right? So business requirements, business goals, technology. And so we're not saying that user experience research or user experience design is going to answer all those questions.
Mhm.
It's about having that another key component of your overall business plan, right? So business, technology, user experience. And through user research, especially now, you can gain that direct confirmation of needs, right? And help set priorities that matter most to a variety of different stakeholders in your business ecosystem, right? From end users to buyers. So some of the data you'll collect will represent short-term requirements. How are we dealing with this now? It has to be this way for your product. While others will represent longer-term requirements. And as I mentioned earlier, even uncover opportunities for the vision of your product. So the data you collect today from user research will uncover needs and new opportunities you hadn't realized, and that will allow you to build it into your product roadmap towards a new vision.
Those are some good points. Yeah. Um, how do you think people, like, I'm just trying to put myself in a product manager's shoes right now. And how do you even predict what is going to stick? Like Dinesh had mentioned, being able to predict what is going to stick and what's kind of a temporary thing.
So the great news is you don't have to predict. If you watch people using your product, they'll tell you because you'll be able to see. And I think Lorraine probably has a big smile on her face because that's the essence of what research does. It doesn't require you to be a wizard or somebody who can see the future. You just watch, and you watch people delighted in the use of your product in certain ways. The ones that are that people enjoy, just because we're human and we get reinforced when we do something we like, those are the ones that stick, and the ones that are painful are the ones that are likely going to fall away. Lorraine, feel free to jump in.
Well, it's about and so not everything is rosy, right? Too. So even uncovering pain points, what are people struggling with? Or if you think about digital therapeutics too, like we're seeing some successes and we're seeing some failures, but the path to success is learning too as you iterate, right? And so as you iterate, you figure out, okay, and you get that much closer. Okay, this is getting the outcomes I'm looking for. Let's build on that, and you keep going. But unless you do the research, you can't figure out what that foundation or benchmark is upon which to improve, right? Or you put it out there and don't do anything, it's going to fail. It's not going to get any better. And so definitely the data helps secure this path where user research helps you with along the path so that you keep going towards that.
And it doesn't sit by itself.
Endpoint.
Like a great firm, plug for us, is that they're able to take that research, quickly iterate it into a prototype of some sort, so you can make an assumption, a hypothesis, validate it, iterate at a very, very low cost. And then as your confidence grows and your uncertainty shrinks, you then begin going for higher and higher fidelity, more and more from migration from pure design to more of the engineering side, which is taking care of all of the many things around security and around data privacy and all of the other parts that are key to being putting a successful product to market, a regulated product to market. But the benefit of it is that you understand why every decision that you made was made. And if you ask a product manager, and you said, thinking through a product manager sitting in their shoes or standing in their shoes, well, most of the time they don't know why a button's the way a button is, or a workflow is the way a workflow is. And there's a lot of confidence that comes from understanding why and being able to point to a set of data, because it just allows you to move forward with much more confidence. And so I think, though you're right, and in fact, you learn much more from your failures than you ever do from your successes. And the key thing is to fail cheaply. That's what I've learned.
Yeah.
You absolutely have to fail, but fail cheaply. And research allows you to fail cheaply, quickly, so you can get to that ultimate success.
That's a great point. Emphasize the cheaply.
Yeah.
When it's, what did you say, 30 million to put out a med device? Yeah. Okay, well, that pretty much wraps up our conversation today. Hopefully everybody was able to get some insight out of today's conversation on how user research can be a really useful tool right now for anybody creating products or services within the healthcare space. And that's pretty much all.